Okay, let's get started. I first like to acknowledge the traditional owners of the land on which we are meeting, and I pay my respects to the elders past and present and the Aboriginal elders of other communities who may be here today. Good afternoon, everyone. Thank you for joining this month's webinar titled Air Pollution in Kids and Schools. I'm Sabrina Idris, a Center for Safe Air Postdoctoral Research Fellow, and I'll be chairing today's webinar. So children are especially vulnerable to air pollution, which can have both acute and long-term impacts on their health and well-being. Allergies, asthma, and the airborne transmission of infectious diseases are the most visible impacts of air pollution for children under 15 years of age. However, beginning in the womb, children can be exposed to air pollution that impacts their long-term respiratory, cardiovascular, and cognitive health in ways that are less obvious. Improving air quality in the settings where children spend much of their time, such as schools, playgrounds, and in the home, represents an important opportunity for improving health outcomes for Australians across the life course. Today, we are privileged to have two esteemed speakers, Dr. Amanda Wheeler and Hayley Dyke, who will shed light on air quality and children's health. Each speaker will present for up to 20 minutes, followed by a Q&A at the end. So please drop your questions and comments in the Q&A section below. Our first speaker is Hayley Dyke. Hayley is a graduate of the University of Wollongong, holding an MPH from James Cook University, majoring in disaster health and humanitarian assistance, and a Master of Philosophy in Applied Epidemiology from ANU. She is currently working as a medical lead for Communicable Disease Surveillance and Response in the Northern Territory's Centre for Disease Control, and previously worked as an adjunct researcher at the Menzies Institute for Medical Research in Hobart. She is working towards a fellowship into the Australasian Faculty of Public Health Medicine, and her interests are in epidemiology, communicable disease and environmental health, and public health, emergency responses and preparedness, and she has a passion for teaching and education. Today, Hayley will talk about the first Australian nationwide study that evaluated the association between ambient PM2.5 and NO2 exposure and school-level national assessment program on literacy and numeracy scores. We are thrilled to have you join us today, Hayley. Over to you. Would you like to share your screen?
Entire screen. Okay, sorry, I've lost sight of the presentation, so hopefully that's sharing. Is that right, Sabrina?
Yeah.
Great, thank you so much. So thank you for that introduction. So yes, my name is Dr. Hayley Dyke, and although I am working at the moment as the Head of Surveillance and Response up in the Northern Territory's Centre for Disease Control, so in communicable diseases, this research I was completing across 2022 and 2023, and my thanks to the organisations listed there for their support in doing this research, and of course to my current organisation for allowing me time to talk today. So I'd also like to acknowledge the traditional owners of the lands meeting on today. I'm dialing in today from beautiful Larrakia country, but I'd also like to acknowledge this research was done in Lutruwita, Tasmania, so the lands of the Palawa people. And I extend my respects as well to elders past, present, and emerging from all the lands we're meeting on today. So childhood educational attainment is an established and important social determinant of health and future earnings. And literacy and numeracy skills in childhood are strongly associated with educational attainment and health literacy and job opportunities into adulthood. And the optimisation of literacy and numeracy in children is therefore increasingly being recognised as an important target for preventative health strategies. And there's growing evidence in a few studies from Australia, including this one, and many more studies internationally, that increasing exposure to ambient air pollution may be associated with poorer performance in cognitive and academic testing in children. And in particular, nitrogen dioxide, or NO2, and particulate matter less than 2.5 micrometer diameter, or PM2.5, have been negatively associated with student performance in maths and language and science skills. Some studies, however, had some mixed results for those pollutants, and most of the studies I identified in my literature review of the topic were from Western European countries or Asia or the US and South America. And given that Australia has very good air quality compared to some of those regions and lower annual concentrations of PM2.5 and NO2 generally, the objective of this study was to explore if that negative association with numeracy and literacy testing performance also exists in Australia, even at those lower concentrations. So for this study, all primary and secondary schools in all states and territories of Australia that participated in the National Assessment Program Literacy and Numeracy, or NAPLAN testing, for any grade level between 2008 and 2018 were eligible for inclusion. So we used satellite land use regression modelling to calculate average annual ambient PM2.5 and NO2 concentrations by the smallest Australian spatial unit, which is the area mesh block. And estimates were then averaged within a 10-kilometre radius of the geographic coordinates for each included school for each calendar year. The outcome measure was school-level NAPLAN score by grade level, and in each of the 5 NAPLAN domains that are reading, numeracy, spelling, writing, and grammar and punctuation. And scores range from 0 to 1,000 for those, and they're designed to increase by each assessment year level. So we then made 20 multivariable fixed effects linear regression models, and we did that for each grade level and domain. And listed in the light coloured box there are some of the school level covariates which we adjusted for in each regression model. So those are some characteristics about the school, like its sort of funding sector and the staff per student. It's remote list levels, so where is it in the country? How many students were female or had a language background other than English, and how many weren't there or exempt from NAPLAN testing, and the index of community socioeducational advantage score, which I can discuss a bit more at the end, but that score uses the proportion of Aboriginal and Torres Strait Islander students as part of its calculation, and so that's why they aren't represented in this list of covariates. So weighting was also applied to the models to account for differences in the size of each contributing school. So in summary, a total of 9,268 unique schools were included in this study, and just over half of those were located in the major cities, which you can see kind of clustered around in that map. And 69% were in government-only funded schools, and 68% were in primary schools, which is fairly standard, as we have lots of smaller primary schools that then funnel up into the larger sized secondary schools. So overall, exposure to air pollutants in this study was low by international standards. And so the red values on the next 2 maps is relative just to Australia, rather than being drastically high values outright. So we calculated for each statistical area level 2 area, sort of averaged pollution estimate. So where there was more than one school in these areas, we took the average of the schools altogether. So these maps kind of give an indicator rather than being an absolute value to go by. But this map shows for PM2.5, schools located in those coastal capital cities and in the remote and very remote areas of Australia experience comparatively higher annual concentrations of PM2.5. And the main source of PM2.5 are likely traffic-related air pollution and wood heater smoke in the cities, in those coastal cities, and it's dust and bushfire smoke in those more remote areas. So this map shows that the schools in the inner regional and metropolitan areas, particularly along those coastal capital cities, have kind of comparatively higher annual concentrations of NO2 than the regional and remote counterparts, where that sort of green is. And traffic-related air pollution is the most significant contributor of NO2 in Australia. So I'm just going to quickly re-summarize some of the analytical key points up to now, because there's been a lot of information so far. And so across a 10-year period, we use linear regression to examine the association between annual exposure of PM2.5 and NO2 and school-level NAPLAN score for reading, numeracy, spelling, writing, and grammar and punctuation. And so the next 2 graphs I'm going to present are representations of the regression coefficients and associated 95% confidence interval that we produced from those regression models. Each figure has sections for grades 3, 5, 7, and 9 results, as listed in those columns on the bottom. And each of the domains is represented by the same colour and shaped marker for every figure per the legend across the bottom. So for example, all the results for reading are a yellow circle, and the numeracy results are a light blue cross, and so on. So a result is considered significant if that confidence interval does not cross 0, and that's represented by the horizontal dotted line across the graph there. So this first figure shows the change in score per unit increase of PM2.5 within that 10-kilometre radius of the school. And so the largest value was for numeracy in grade 7 at the bottom there with a little blue cross. And that indicates that for every increase of 1 unit of PM2.5, the school level NAPLAN score for numeracy in grade 7 decreased by 1.04 points. So we found at this radius that for scores for reading, numeracy, spelling, and grammar and punctuation had mostly significant negative associations with increasing PM2.5. You can see those are all mostly clustered under that horizontal line of 0 in the middle there. And there was an unexpected significant positive association with writing in grade 9, though, that orange triangle up the top. So contrary to our expectations, we actually found that increasing annual average NO2 was positively associated with school level scores in all domains and at all grade levels. And so that means that as NO2 increased, so did the school's scores. And generally the size of association, though, appears slightly smaller for grades 7 and 9 than it is for grades 3 and 5. And in the following slides, we'll just talk through some of the reasons why this might have happened. But first, we'll just think about PM2.5, so some of those negative associations that we found in literacy and numeracy skills, sort of in the order of a reduction around 0.27 to 1.04 points in score per unit increase for PM2.5. And so on this slide, I've just also put up the results of a Brazilian study and a Chilean study that use similarly scaled national testing, so similar methods and similar scale of scores, and their study designs were very similar to this. And you can see the results are actually quite similar in magnitude to ours. But the maximum PM2.5 concentrations recorded for those two studies were 30 and 34 micrograms per cubic metre respectively. And that's almost 3 times the maximum that we recorded in ours. And yet the similarities between our results and those studies suggest that perhaps the greatest impact of PM2.5 on academic performance might actually occur at those lower concentrations, as marked with the blue arrow on this picture on the slide off to the right. And so this graph just aims to show that for air pollution and other environmental exposures, often it follows a superlinear concentration response curve. And so rather than it being quite linear, it has a very steep increase at those lower levels of concentrations for those negative health impacts. And so Australia kind of sits right at that start of that curve, where the greatest impact for us might actually be at our lower concentrations. So considering nitrogen dioxide now, while we found some significant positive associations between increasing NO2 and increasing NAPLAN score, there's also some examples in both the Australian and international literature where cognitive and academic performance were associated in unexpected directions also. So for Australia, living in the built-up inner city areas can be quite expensive, and it's most likely that NO2 and traffic-related air pollution more broadly could actually be functioning as a proxy in our study and possibly other Australian studies for some unmeasured residual confounding factors that are actually related to socioeconomic status. Those might include things like household income, the family structure, the proximity to health services, ability to access external services like tutoring, could be in school leadership, the quality of teaching provided, or even the choice of curriculum. So lots of things that might impact it. And PM2.5 might be less affected by this phenomenon than NO2, just because the primary sources of PM2.5 in Australia are a bit more diverse than just traffic-related air pollution and less directly aligned then with some of these socioeconomic factors. And it might have been easier for us then to have adjusted for this confounding in the study for that particular variable. So some other limitations to this study include the fact that it is population level, or it's an ecological study that just considers performance at one point in time. And so some direct inferences about the student level impact can't really be made at this stage. And secondly, the number of models that we used introduced a 43% probability that at least one significant result was obtained by chance. And we also haven't really accounted for clustering effects, and we've currently updating, or had an attempt at updating the model to be more of a random intercepts model that can kind of fine tune the coefficients, but it hasn't significantly changed the pattern of results, and we're still finding it quite difficult to adjust for that effect. And finally, NAPLAN itself has been widely criticised as an indicator for literacy and numeracy ability as the necessary language skills and contextual knowledge that possibly affect its validity as a population level tool, as well as it's providing a relative indication of performance rather than an absolute one. So in conclusion, some of our results contribute to the assertion that no level of PM 2.5 is safe, and that although Australia enjoys comparatively good air quality, there's more and more reasons for us to continue to reduce our exposure at a population level. And this might be in the form of continuing to tighten regulatory standards for traffic-related air pollution, or supporting people to use alternative sources of heating to wood heaters, supporting sustainable land use and management practices, and advocating for real action to tackle climate change. And some further research is also warranted to untangle some of those likely residual socioeconomic confounders. So it looks like it could be difficult to do that, and to better understand the impact of air pollution at an individual level on academic progression. So I give lots of thanks to the people on this slide that helped to do this research, and some beautiful pictures of Tasmania I took before I left, which notably has some of the best air quality in the world and is a beautiful part of the world. So I'll stop sharing my screen if that's okay.
Thank you so much, Hayley, for sharing this.
You're welcome.
There are some questions in the chat, but we'll come back to them after all presentations have ended. So our next speaker is Dr. Amanda Wheeler, who is a Senior Research Scientist in Multi-Phase Atmospheric Chemistry at CSIRO. Amanda's career has focused on understanding human exposure to environmental contaminants and resulting health effects. Her research interests include identifying suitable interventions to improve both residential and school-based indoor air quality. Throughout her career, she has led several international interdisciplinary research projects. Today, Amanda will speak about the Safe Routes to School study on traffic pollution and active transport. We're very glad to have you here today, Amanda. Would you like to share your screen?
Thank you very much. Hopefully this will work.
Yeah, that is great. Thanks.
So thank you very much for the invitation to present today. The project was initially supported by this Centre for the, I can't remember what previously iteration of the CSA was now, but I appreciate the funding. This was work that was conducted with a broad array of researchers, and my last slide includes names of everybody. So this is not something I've done on my own. We wanted to set out to characterize and compare children's potential exposures to traffic-related air pollution, thermal comfort and noise, comparing direct and alternative routes for active transport to school. And we also wanted to think about, would it be possible to tease out any recommendations that school communities could apply when they're thinking about selection of these commuting routes for the children. So the motivation for this sort of stems around the fact that we've over time, I think we're beginning to understand that the commute portion of children's day-to-day exposures represents quite a significant source of exposure to traffic-related air pollution, as well as other indicators of environmental health. And we know that not all particulate matter size fractions impact health equally. There's a lot of understanding and regulation of PM 2.5, which is the size fraction that you can inhale into your lungs. There's a growing body of evidence around the impacts of ultrafine particles, which are not regulated. And I'll talk to that in a little bit more detail coming up. We know that there's some evidence now that, obviously Hayley's presentation was well timed, that there's growing evidence that traffic-related air pollution around schools can influence children's learning capacity. This is also shown in Barcelona in a study that they conducted around cognitive function. The guidance, especially from the World Health Organization, is that school-age children should engage in moderate to vigorous physical activity for at least 1 hour a day. And so quite often I think that the active transportation to school is one of those ways of gaining that physical activity. So either walking, cycling, scooting, that kind of thing. So in terms of the health, we want to make sure that while you're doing this physical activity, which is beneficial to your health, you're not offsetting it by breathing in the negative impacts of trap and noise. And so we know that children are vulnerable, more vulnerable, and they're one of the priority populations when we think about air pollution and health. They do have smaller lung volume and structure, and they breathe at a faster rate. So obviously, breathe in more of the air pollution, and their immune systems are developing. So we know, as I said, that there are poor health outcomes, and these are really across the board in terms of health now, including respiratory, cardiovascular, cognitive decline, birth outcomes. And so I think any way that we can reduce exposures to traffic-related air pollution or air pollution in general is beneficial for a range of health endpoints. So to move on to the study design, there's a lot of information on this slide. I apologize for that. I'll run through it. We wanted to compare direct routes with alternative routes around 3 schools. And the direct routes, I'll show a map so you can understand this, but we felt that 1 kilometre distance from the school was a reasonable distance for primary age children to actively commute. And so a lot of the time organizations such as Bicycle Network engage with the school and children, and they sort of create these routes for cycling in based on safety and identified landmarks so that the children actually don't get lost between their home and the school. But there's no consideration around the effects of air quality or environmental exposures. So we wanted to look at different routes, alternate routes that would potentially reduce those exposures as well. We monitored a range of different traffic-related air pollutants, ultrafine particles what I'll be presenting today, but we also had done, in some situations, we were able to include black carbon, PM 2.5 and noise, as well as the human thermal comfort, which somebody else is working on the analysis for that. So for the ultrafine particles, these are particles that are less than 0.1 micrometers in diameter. So when we talk about PM 2.5, it's particles that are less than 2.5 micrometers, just so you have some context for those. Sources for ultrafine particles include fuel combustion and traffic, obviously, fast food outlets, and then there's also a sort of an atmospheric component where there's secondary aerosol formation typically on hot, still days. So what we wanted to do, we wanted to do 2 return trips along each route during the morning and the afternoon commute period. So we were out between sort of 8 to 9 in the morning and 3 to 4 in the afternoon, around the times that children would normally commute. We repeated this typically Monday, Wednesday, and Friday at each of the schools. We tried to include some background measurements so that we could just understand what was happening generally with air quality in the region. And we also wanted to sort of understand, was there a contribution from school traffic? So parents and guardians dropping off children at school in close proximity to the school. So so here's the example of one of the schools. So in the middle here is where the school is located, and these are 3 of the starting points for the routes, which are here on the figure. And so the bolder route is the alternative route, so one that we had selected based on our understanding of sources of air pollution, and then the lighter coloured routes are more direct routes. And so we had 6 people out walking with backpacks with around $40,000 worth of equipment in each backpack. So felt that we should do that rather than give them to children. And so for the 3 schools, a similar setup was designed. So it's for some results. For the ultrafine particles at school 1, I've presented the 97th percentile of concentrations of the ultrafine particles, because we were very interested in understanding where are the hotspots and what is causing those higher exposures. And so you can see that on the direct routes, there's more hotspots. And I've included some photographs of why those areas would potentially be have elevated ultrafine particle levels. And so it's major roads, cars queuing to turn into intersections. There's also a retail arcade, as you can see along the side of the road. So cars frequently stopping, a diesel bus stop. And also there's signaled intersections, which can have a high number of lanes of traffic as well. For the second school, we again presenting here the 97th percentile for the ultrafine particles. So I should point out that the background levels of particles tend to be around 10,000 particles per centimeter cubed. And in this situation, these values are up around 28 to 30,000 average. So quite elevated. So the alternate route suffered a little bit from having to cross the highway on a footbridge, and so quite frequently we found that a lot of the trucks were waiting for the traffic lights at the big intersection down here, and so as you crossed over the footbridge, you just got a lungful of diesel emissions as you crossed the bridge. The school road is here. This was a truck-free route in theory. We certainly witnessed people getting fined for driving their trucks down there, which was good, but they were still driving the trucks down there. And certainly in the holidays, it's not a truck-free route. So the expected reduction that we had hoped to see didn't actually transpire, because a lot of the trucks was using this road during school holidays. The route 3 was the direct route, actually included quite a lot of green space, and so we had very little low levels of ultrafine particles on route 3, and only covered that route for the first phase of sampling, and focused our attentions on the other routes 1 and routes 2 after that. And for school 3, we had a route the direct route that ran down this busy road next to a busy train line as well. And so we could see that that was a source of a lot of the ultrafine particles. When we look at the improvements, when we compared the direct route with the alternative route, we generally saw an improvement, and that was between sort of 30% to around 10% improvements. Where there's 0, those 2 routes had a lot of green space along the direct routes, so we're not generally as badly polluted as the other routes were. And we also saw reductions in noise exposures as they moved away from these busier roads. So again, that's something to take into consideration with the routes. As I mentioned, ultrafine particles can also be from secondary aerosol formation. So it could be that on this date, there was very still conditions with high temperatures. And so over the local area, there was a regional episode of ultrafine particles. So all routes ended up being elevated. But when you sort of drill into the data and we just focus in again on the highest concentrations of the particles, so up around the 28 to 30,000 particles per centimeter cubed, you can see that still, you know, this intersection and this bridge and along this road have very local contributions to exposures. So I think that's something that we, you know, we're very interested to be able to tease apart, that, you know, regardless of what's going on within the climate, these local exposures are important as well. As I said, we wanted to sort of also sort of get some ideas around reducing or selecting land use where the routes could be located. So we can see that there was a lot of variability in each of the routes, but generally if you had an arterial road or a commercial land use for, you know, a shopping centre or a junction intersection, there was generally elevated levels of ultrafine particles. When we looked at the land use where there tended to be more parkland, even if it was sort of mixed use with parkland and residential, there was also generally a drop in the concentrations of the particles as well. What was interesting to us was that where we had sort of allocated land use to being residential, there was actually a huge variability. And so I think we've got to really think about how to tease out the factors that are really important in the residential area. And I think for Melbourne, a lot of the residential areas do have high truck traffic through them. So I think that we need to be cognizant of how we choose our alternative routes based on that. So in conclusion, we felt that the alternative routes can provide a significant reduction in exposures to traffic-related air pollutants. We have seen that the major road intersections and crossings are one of the key determinants of exposure, and that selecting routes that avoid sort of commercial land use and intersections can also reduce exposure. But we can't assume that all residential land use will have low traffic-related air pollution concentrations. So I'd like to acknowledge the extensive range of collaborators. We had borrowed instrumentations from the University of Melbourne and the Australian Catholic University. We also had seed funding from CAR. And just like to thank all of the research assistants that trudged around the neighbourhoods, especially on the hot days, and Bicycle Network for route support. So here's my contact details if we don't get to your specific question. And just I had mentioned that the instrumentation was around $40,000, but so you can see here the types of equipment that we carried around in the backpack. So thank you.
Thank you so much, Amanda, for sharing your work. That was a very insightful presentation. Now we'll open the floor for any questions that the attendees may have. I'll first ask a few questions from Ingo Koronike, which were sent via email. So Ingo's first question was that there is a strong reliance by the Land and Environment Court and Council planners on the NEPM standards to guide land use planning in local government areas. Using particulates PM 2.5 as an example, and given there is no safe health level, is NEPM still appropriate for determining the health impact on young children? So Ingo has read that the proportion of children in the population and level of health risk is significantly much higher compared to adults. Amanda or Hayley, do you have any thoughts on this?
Are you happy for me to answer, Amanda?
Yeah, please.
Yeah, so I think the standards are a really good example of how we try to regulate and try to legislate a little bit air quality in this country, but it's up to each jurisdiction, state and territory and then probably on smaller government levels than that, about how it's enforced. And so it's the enforcement is a bit less clear. And so I think what we aim with these standards is that they are a standard that we should be working towards, so a guideline, rather than something that can have penalties actioned against it, or sort of disincentives applied to it. And so they're really important to have there, but kind of looking to them as the enforcement of air quality is a little complicated. So I agree. I think the national EPA is always looking and reviewing. And so in 2019, they kind of lowered the threshold for PM 2.5 to try to tighten it. There's talks, and there has been changes in the past about NO2. They're wanting to expand that to other air pollutants to try to sort of make our standards even higher for this country. And then it's sort of up to everyone about how we make them. But it's a little complicated.
Thanks, Hayley. So they also had a question about PM 2.5 and dose and response. So they were asking whether what level of exceedance above the NAPM standard would be considered acceptable for younger cohorts. And in determining the health risk to young children in schools adjacent to major roads, is using the annual average exposure for particulates PM 2.5 better than the 24-hour exposure?
Yeah, so for our study, it was just a more practical measure to use that annual exposure. But I think in terms of that day-to-day, in real terms in practice, 24 hours is also a very useful indicator, particularly to get that a bit more of that fluctuation through seasons and through different, particular events, smoke events or other things happening. So as a measure for that thing, I think it works better. As I said, our study was caveated with a lot of limitations. So I think it depends on what you're trying to do. And again, that exceeding of the standards of the guidelines, they're set because we want to try to reduce as much exposure, because no exposure is the best exposure. So there's not really, once you've exceeded a guideline, you've exceeded it. So it's not that there's an acceptable level above that necessarily from a health perspective.
Thank you so much, Hayley. I guess I'll ask Amanda next about your study. So I think Arabella was wondering, in the study, were you able to identify when children walk through smoke plumes on their routes, especially in the colder months on the alternative residential routes?
No, we weren't. We've averaged the routes so that we could get a better understanding of typical exposures. So we haven't gone into like very specific events per se, other than when we had looked at the secondary or aerosol formation, and that's still climatic conditions. But yeah, I think we weren't conscious of there being wood heater smoke emissions as we were walking around. We certainly tried to make note of anything that was a problem, certainly for the noise, because certain days were the garbage trucks were walking along. As we walked down the pathway, we had a big truck next to us. So we've just tried to manage very specific events out of the analysis, just so that we could look more generally at factors that could be managed more generally when considering route selections.
Thank you, Amanda. So for Hayley, there's another question from Arabella. So Arabella mentioned that Australia may have generally good ambient air quality, but it is poorly understood that our schools are located in air pollution hotspots, nestled amongst homes in highly polluting wood heaters. Arabella's daughters have spent their entire schooling lives breathing in neighborhood wood smoke blowing across the school grounds. Would you agree all schools should have air quality monitors and a case be made to have clean air zones around schools where wood heaters are not permitted?
Yeah, I think it speaks again to what I mentioned before about it's up to jurisdictions and councils to sort of make the rules about how they're going to try and attain certain air quality standards. But I think it makes a very good point. It's a very good question, and certainly air quality monitoring in schools is something that has been explored in other research, predominantly research settings, but there's potentially an expansion to having that as something that schools can use as a tool to try and get more information about air quality around their grounds and protecting their children a bit. So sure, I think it's a good idea, but
yeah,
yeah,
and
you're
I'm
definitely not
certainly,
alone out there.
yeah, no, and I'm certainly aware that there's a lot of more citizen science happening with the low cost sensors. So you could make a decision about, do the children go out at the break time or not, because the air quality is poor. So I've certainly seen that coming up more and more.
Yep. And for Amanda, Alithia was wondering, are you aware of any research into use of the effectiveness of green infrastructure along traffic corridors in mitigating exposure? For example, by helping separate active transport routes from traffic and creating a barrier to or absorbing pollutants.
Yeah, I think that that's an area that's gaining some traction, and there's not a huge amount of science at this point, but it's certainly something that we had discussed with the Department of Transport as a next step, but we haven't progressed that one yet. But yeah, I think that the use of these green walls and green barriers seems to be working, but it's very case specific. So I wouldn't want to say, yeah, everybody go out and put a green barrier in. But I think it's it's something that we need to find some solutions, because reducing traffic has been on the demand list for a long time but yeah, they're not going away.
Thanks, Amanda. So the next question for Hayley is from Todd. So Todd was wondering, what is the relationship between wood heater density and other socioeconomic or educational factors? His intuition is that poorer communities use more wood heaters, at least in Tasmania. Did you attempt to tease out these confounding factors?
Yeah, so the sources of PM2.5, we were not able to kind of differentiate. As I said, you can make a generalized assumption that along the coast and in the more built up areas that the contributing sources of PM2.5 are likely to be wood heaters and traffic. But teasing out the proportion is just not within the scope of our study. But what I would say is that if you're in a Tasmanian context, it sounds like you might be, the Tasmanian Population Health Survey every 3 years does a sort of quick look at the association with wood heaters and other demographics. And the connection that in the last one that I was involved with last year was for socioeconomic status, a bit more complicated, that actually in the higher socioeconomic status groups, there's another little peak up there too. So it's not a sort of linear association with socioeconomic status at all. And in fact, some of those in the sort of lowest, poorest group, the housing provided now often is built or designed with reverse cycle heating and other sort of electricity measures rather than wood heaters built in. So the relationship with socioeconomic status is actually quite complicated for wood heaters.
Thanks, Hayley. So the next question is about whether CO2 was measured in your study, Hayley. And if so, what are your thoughts on CO2 being a significant contributor to cognitive behavior in the classroom?
Yeah, so we didn't include it in ours just for not having quite the same level of robust data as we did for PM2.5 and NO2. And the evidence across the literature when I was reviewing everything was kind of also still kind of emerging behind even where we're up to with PM2.5 and NO2, and a bit conflicted. So I think it really depends on the specific setting and your exposures, and I would probably need to do a bit more reading before I confidently answer that question.
Thanks, Hayley. For Amanda, Todd was wondering, could a simple change of having school bus drivers switch off their engines while picking up students make a positive difference?
Yeah, we were hoping to capture that on the school holidays so that we could say, oh, it's not about kids being dropped off, and but the route that we had chosen was one that was a truck route only during trucks were banned only during school time, so we weren't able to pick that up. But certainly the bicycle network concept was that they would create a location where families could go and drop the children off at a distance from the school, and then they could actively commute in, which I think is one way of sort of reducing that exposure around the school in a safe way for the children to actually get to school. But yeah, we weren't able to pick that up.
Yeah. And the next question is from Jeff, I guess to the both of you. Are you able to link the magnitude of changes in exposure you saw with any specific health effects from the literature?
I haven't got to that stage yet.
No worries. Hayley, there's a question from Leonard. Could it be that residual confounding explains the nonlinear curve you showed for PM 2.5 rather than the real effect being nonlinear? Imagine a fixed size impact of the confounding, which would seem relatively larger in Australia's low exposure environment.
Yes, so that graph that I put up on my slide was sourced from an international document. So it's kind of just a general model of how environmental exposures go rather than air pollution specifically, or this particular scenario. So as a possible like model out there for how it works. And generally, the principle of it is just that you're giving the entire population exposure to a thing, and then that it just the effect is just so much more complicated than other dose response relationships that we see for other things at all. So yes, it's possible that residual confounding exists within that particular model, but that's not a curve that I generated or that I, have had input into, but more just an academically accepted model of how environmental exposures may work.
Yeah. And there's an anonymous question. It said, thank you for this great presentation, Hayley. I'm just wondering how the effects you found in this study relate with other factors influencing cognition, like SES background from parents, nutrition, etc. Wouldn't we achieve better gains by focusing on giving everyone the same chance for a successful education rather than focusing on exposure to air pollution, which is very low already in Australia? Apologies, not trying to attack this interesting research, but just genuinely wondering if you have thoughts about this.
No apologies needed. Look, honestly, this question makes me really excited. I feel very passionately and the same way, in fact, truly about this. So I work in communicable diseases at the moment. That's my passion. The same principle applies here, that actually the things that drive it are socioeconomic, inequity kind of related factors, and that actually a lot of our actions could be focused on those sorts of things. I think the same thing is true for education. So absolutely, those are things that would probably see quite bigger changes. And certainly in this research, we're looking at statistically significant changes. Does 1.2 points make a difference across a whole school? Unsure, unclear. But then when you sort of magnify that at the number of students that are averaged to make that, and that the impact on each individual student, it could be just one more thing contributing in to other factors which are very difficult to address at a whole population level. So I think what we wanted to show with this study too was just that the impacts of poor air quality go so far, like directly to some health conditions, and also indirectly to other things that impact on health and other things as well, and show just the breadth of impact that air pollution truly has. But I fully agree that some of our most effective measures are actually targeting those other factors for sure.
Thanks, Hayley. And for Amanda, so how can we manage children to play safely outdoors if the childcare center is positioned on a very busy road or intersection?
Yeah, so I had done some work when I was in Perth around that issue, and so we were able to show that there are, as peaks in when the air pollution occurs around the commuting time. And so we had made suggestions to the daycare directors that perhaps they could consider that children go outdoors when air quality was better, so not in the commute times. And I think there is a growing body of literature that is suggesting that you can keep indoor air quality a little bit better with the use of things like air cleaners as well. So there's the planning is a bit back to front for me in terms of where you locate a daycare. It's usually on a busy intersection so that it's accessible and easy for, you know, getting kids into school as you head off to work. But I think the reality is that, you know, that air quality is a major factor when it comes to children's health. And so I think we need to really think about how do we resolve that.
Thank you, Amanda. So Hayley, Jeff had a question about the NAPLAN study. Have you looked at impacts of SES or inequity specifically and NAPLAN scores?
Yeah. So for this study, because we used the whole school score, socioeconomic status was a really difficult thing to approximate. And so the NAPLAN group, ACARA, generate their own index of community socioeconomic educational advantage, I think, ICSE, which to their calculations explains 70 to 80% of the divergence between schools. And that score takes into account like parental occupation and, oh gosh, what's the other thing? A parental education status, I think. So it tries to kind of give the school a grade on this aggregate score of students, which obviously the diversity of students within a school is massive. So I think the next step that goes on from this is a more individual level study that can better assign socioeconomic status and those variables to better tease out some of that relationship with education and score. But yeah, the difficulty of us doing an ecological school level study.
Thank you, Hayley. And I think the last questions come from Pratika for Amanda. Pratika wanted to ask, was the exposure calculated just for active travel, or was it also calculated for students commuting through different ways? So that's the first question. And the second,
it was just so it was just that commuting period.
Yeah. And does the measurements also done near school for some time or just for the travel time?
Just for the travel time.
Okay. I think we got through all the questions already, which is good. And we're reaching to the end of the webinar. So I'll just conclude today's webinar. And before I do, I just want to extend my sincere appreciation to Amanda and Hayley for their excellent presentations on this topic. We hope the attendees have found the information valuable and insightful. And if you have any further questions or would like additional resources, please don't hesitate to reach out to the Center for Safe Air. We look forward to seeing you at our next webinar, which will likely be on air pollution and comorbidities such as diabetes, to be held in mid-August. We'll send out invites for this upcoming webinar soon after we have confirmed the speakers. So thank you so much, Amanda and Hayley. Have a wonderful day. Bye.
Thank you.
Thank you.